Okay, good afternoon. With a sufficient number of subcommittee members in attendance, we will go ahead and get started. This is March the 5th, and this is a meeting of the Government Operations and Health Facilities Subcommittee of the Health and Government Operations Committee. We're here today on a work session discussing 11 bills. We'll take them up in this order, which has to do with their complexity and the number of people who are likely to want to be heard on each bill. We'll start with 580, go to 1334, 1104, 106, 905, 622, 448, 466, 699. We'll take up 765 and 1324 together. Then we'll go to 304 and hopefully we will get to 1422. Let's begin with House Bill 580. And
this bill alters terminology throughout the code so that references to the Maryland State Firemen's Association are replaced with the Maryland State Firefighters Association. References to the Disabled Firemen's and Rescue Squadmen's list are replaced with Disabled Firefighters and Rescue Squad Persons list. And references to firemen or firemen are replaced with firefighter or firefighters. References to squad men are replaced with squad member. There are no amendments. And the cross-file passes the Senate 46-0.
Move the bill.
all right,
Second.
we have a motion and a second on the bill. Any discussion? Take a vote on the bill. All in favor of the bill?
Aye.
Any opposition? Okay, we'll move that bill on ahead to the full committee with the recommendation of the subcommittee. 1334.
This is a Garrett County delegation bill that authorizes Garrett County to enter into a purchase or work project contract for an indeterminate amount of goods or services procured on an as-needed basis over a period of time without advertising for bids, regardless of contract value. It also authorizes Garrett County to enter into a contract for the purchase of one or more vehicles for up to $100,000 without advertising for bids. There are no amendments.
Do I hear a
Move the
motion on the bill? Okay. And I have a motion. Do I have a second?
Second.
Okay, Delegate Hill.
Quick question, from my notes from the time, I'm really concerned, those of you who do local government, why is there no concern that there's a lack of accountability at any level with this bill? And I don't know if someone's here from the county to address that. I know it's a local bill, I'm not trying to hold it up. Can anyone, I don't know if the sponsor's here, anyone from the county or anybody who has no problems, who's on the committee, explain to me why we don't have to be worried that there's no real accountability in the bill.
The sponsor is not with us.
Okay.
Delegate Chalega?
I'm assuming we have a delegation letter.
Well,
It's just the one member, but yes.
it's only one member in the delegation.
Do we have it's for the county council or their commissioner style government? Did we get anything from the commissioners? Is that why it was requested?
Yes, we got a letter of support from the county commissioners, and the sponsor testified at the hearing that Washington County does this as well.
Okay. Thank you. I would move the bill.
Well, the bill's been moved and seconded, so I'll go ahead and call for a vote. All in favor of House Bill 1334, say aye.
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 Opposition to 1334? Okay, we will move that one on to the full committee as well.
Mr. Chairman, can I just suggest that before we get to the vote on whenever we're voting, we get Dr. Hill's question answered? I don't know if we can
Thank
nominate,
you, Delegate Kipke. I'd appreciate that.
but your opinions are very important to me,
I
which
appreciate
is
that.
why I'd like to nominate you to get the answer.
All right, I'm calling some staff now.
We're up
I'm
to.
going to ask Lindsay if she can just reach out to the sponsor and ask him to address the question. Is that possible, Mr. Chairman? Is that possible, Lindsay?
Yeah.
I will note that we are voting at 2.
Okay, we have Aaron Bill next, House Bill 1104. If Aaron's not,
I'm here. I'm sorry. I was ready for 11. You said 9:05?
Well, 1104, 905, whichever one you're ready for. We'll take them back to back.
Okay. Let's do 1104
Okay.
first. Okay, this is a departmental bill that establishes the Population Health Improvement Fund to support statewide population health targets under the Advancing All Payer Health Equity Approaches and Development, which is the AHEAD model, and any successor models. Each year, the HSCRC may assess a uniform, broad-based, and reasonable amount in hospital rates to be credited to the fund, which may only be used for statewide population health improvement initiatives. Electronic healthcare transaction information may be used to support the state's participation in the AHEAD model and any successor models. I have provided a reprint of the bill that reflects amendments that have been agreed upon by the Maryland Hospital Association and the Maryland Department of Health. If you look through the reprint, you will notice that on bill page 3, after line 20, there's a new section 2. That section 2 only applies to the Population Health Improvement Fund. And the reason that's been put under section 2 is that you'll see at the very end of the bill, section 2, which is the fund, will sunset as of January 1st, 2032. So the fund will be in effect for 5 years and 6 months. Then moving on, within the bill, other amendment language on bill page 5 in lines 14 through 19 are struck and replaced with language stating that the total each year of the total cost of care model, the AHEAD model, or any successor model, the HSCRC may assess a uniform, broad-based, and reasonable amount in hospital rates to be credited to the fund. The commission must include the full amount of the assessment in the hospital rates, and funds generated from the assessment may be used only for the expenses that are described in subsection F of the bill. So if you go back and look at subsection F, that describes the expenses. And those expenses are that the fund can only be used for expenses associated with statewide population health improvement initiatives in alignment with the statewide health equity plan, and for activities paid for by the fund must support the goal of meeting the statewide population targets that are outlined in the AHEAD model and have at least one of the following functions: reducing rates of common preventable health conditions, addressing health-related social needs, or reducing or eliminating health disparities. Then back down to the bottom of bill page 5, there's a reporting requirement that on or before July 1st, 2026, and each July 1 thereafter, the department must report to the General Assembly, and that report shall reflect the required elements of the annual progress report as outlined in the state agreement, and shall include measures of effectiveness for funded programs, targeted populations, impact on health outcomes and health disparities, and relevant components from hospital-required reporting to the HSCRC on population health improvement efforts. The report must also include an accounting of all sources of funding accepted for the benefit of the fund and the amount of funding from each source.
Thank you. I'm going to go ahead and see if there's a motion on the amendments before we begin discussion. Do I have a motion? Anyone want to
To
move?
move the amendments.
Okay.
Second.
All right, we have a motion and amendment on the second. Opening things up for discussion, I see we have representatives from the Maryland Department of Health here. It was a departmental bill requested by them. So let's see, Elizabeth Crum.
Yes, thank you. So we've worked with the Maryland Hospital Association on the amendments that were read, and we feel comfortable with them. The only thing that we noticed upon the looking at the revised bill draft is that we need to, in section 2, have the same effective date as the bill. So it would need to be July 1st of 2025, and we can follow up with Aaron on that. But
Yeah,
everything else we've.
My mistake, totally. You're right.
No, but this is great. Thank you.
Andrew Nicholas.
Yes, okay, there we go. I just wanted to first just thank the department for engaging with MHA on this and working through these amendments with us. I think the bill is hopefully stronger because of that. By clarifying that how the assessment will work, and the assessments are, approved through the HSCRC, which is, how hospital assessments are done. And then adding in some, reporting requirements, I think, to give the legislature a look is an important aspect of this. So again, we appreciate the openness and willingness to engage and the collaboration.
And the committee also appreciates the work that you've put into this in order to reach an agreement. Let me open it up for questions from the committee. Delegate Shalega.
Thank you, Mr. Chair. So does this still have a $2.5 million annual fiscal note?
So the only thing that's been voted on and approved and is in the current fiscal year is the 25 million that was added into rates that was voted on by the HSCRC back in December, and it was subject to the creation of this fund through legislation. But it is not, they would have to assess in future years and go through their process to add anything further to it.
Okay, so it is part of the $25 million assessment fee tax, whatever you want to call it, that was
Yes.
made in December, but ongoing, this program's going to go on for 5 years before it sunsets. There'll need to be additional fiscal note, tax fee assessment, whatever you want to call it.
Correct. Anytime that the rate setting commission would want to do that assessment, they'll have to go through their process to get it approved and then added. So it's not, the legislation does not automatically guarantee that that happens every year.
Okay, thank you.
I have a motion and a second on the amendments. Any further discussion? All in favor of adopting the amendments, say aye. Any opposition to the amendments? All right, the amendments are adopted. Now may I have a motion on the bill as amended?
I'm sorry, what bill are we on?
1104.
Move as amended.
Second.
Okay, I have a motion and a second on the
Second.
bill as amended. Any discussions or questions on the amended bill? Seeing none, I'll call for a vote. All in favor of House Bill 1104, say aye.
Aye.
Opposition to House Bill 1104. I see Delegate Chisholm, Delegate Kipke, Delegate Shalega voting in opposition. Okay, thank you. Let's move on then to House Bill 905.
This bill was discussed last week in subcommittee. It requires each hospital to establish and maintain a clinical staffing committee that has equal membership from management and employees. Each clinical staffing committee must develop a clinical staffing plan that establishes the appropriate number of clinicians needed to administer quality healthcare by setting. By January 1st each year, each hospital must implement the plan, assign personnel to each patient care unit in accordance with the plan, and post specified information about the plan. By July 1 each year, each clinical staffing committee must conduct a review of the plan to evaluate the effectiveness of the plan during the immediately preceding year, update the plan to ensure that it continues to be appropriate and effective, and develop a process for receiving, resolving, and tracking complaints related to the clinical staffing plan. There are amendments. I distributed a reprint of the bill that incorporates amendments that are being sponsored by the bill sponsor, who is Delegate White Holland. If you look on the top of page 3, this goes to the members of the clinical staffing committee, and it provides that the committee would include a staff physician who is not a hospital employee or administrator. There's also language on line 6 through line 22 that has been struck by the amendments. And with this amendment, the bill would just provide that each clinical staffing committee must develop a clinical staffing plan that meets patient needs. So the bill as introduced was much more specific as to what was in the plan. This clarifies that the plan needs to meet patient needs. And then if you look on line 22, when developing the clinical staffing plan, the clinical staffing committee must consider existing staffing levels, methods to secure coverage needs as necessary, existing gaps in staffing, how to address the gaps, any available evidence-based standards, and a schedule for periodic review of the plan. There is a proofreading amendment, bill page 4 of 5, line 13. The bill required that on or before January 1st of each year, beginning in 2026, that the hospital would implement the clinical staffing plans, but that should be 2027 because they're just required to have the plans by 2026. So implementation would not be until 2027.
Okay.
The requirement that the hospital post the clinical staffing plan on their website has been stricken by the amendments. And then there is reporting language that beginning on or before July 1st, 2029, and each July 1 thereafter, the hospital association shall require a report provided by each hospital that summarize how the hospital's clinical staffing committee has addressed safe hospital staffing through their staffing plan during the immediately preceding year, and provide the reports in a single transmittal to HGO and Senate Finance.
Thank you. Delegate White Holland.
Yes, thank you, Mr. Chair. And again, we have been working very diligently to ensure that we are addressing some of the concerns that were elevated by the opposition. I think that these amendments also are reflective of the conversations in which that we've had in this particular space, and demonstrates how we have listened and are carrying forward some of these resolutions in addressing those concerns. So Aaron provided a comprehensive look at those amendments. But again, I know that there may be others here who can answer any questions in which that folks may have. But with that, I'll yield the rest of my time to the chair. So thank you, Mr. Chair, for allowing me to share.
Oh, you're welcome. And thank you for your work on this, Delegate. Let me go ahead and move these amendments before we call upon people. Do I have a motion?
Move the amendments.
Second.
Okay, a motion and a second on the amendments. Delegate Kipke, I think I saw your hand first.
That was a holdover. Thanks.
Okay, Delegate Chisholm.
Thank you, Mr. Chair, and I appreciate the delegates' work on this. I guess my question really is probably going to be for MHA on, now that we have this amendment, how much does it differ from what your current practice is? And I know you can't speak for every hospital, but the hospitals, from my understanding, are already doing most of this. Does this differ much from what it's in practice now?
Andrew?
Thank you for the question. I haven't seen the amended bill, and I was trying to do my best to follow along, but I honestly couldn't keep it all straight in my head. So if I could take a look at that and get back to you.
That works for me.
Okay, Andrew, if we send this to you, do you think that by the end of this meeting, you'll be able to answer his question and we can go ahead and vote on this?
I will do my best. I will definitely be able to, if I can, I will, and if I can't, I will tell you that as well.
Okay, Aaron, if we move on to a Lindsay bill after this, can you get the reprint to Mr. Nicholas? All right, then let's just hold this bill right where it is till the end of the calendar. Then we will move on to 106. I know we have Chief Phillips here. So let's work on that one so we don't hold him any longer. And Delegate Harris, I don't see if he is here. But Lindsay, go ahead and tell us where we are with this bill. Thanks.
So as originally introduced, the bill expanded the definition of first responder used within the public safety article in reference to the state's 911 emergency telephone system. The amendments offered by the sponsor strike the bill and instead establish that felony assault in the second degree includes an assault against an MDOT first responder engaged in their official duties and prohibits a person from making a false report against an MDOT first responder. So both those provisions are in the criminal law article. MDOT first responder is defined as certain employees of MDOT whose job duties include responding to the scene of an emergency. And I think I saw Cindy Smalls on the call who helped with the drafting of these amendments. I'm not sure if
Did
Denise
Cindy join us?
is here as well.
Yes,
She might
I'm
be
here.
11:09. Okay. Cindy, can you add anything to that?
No, I mean, I just thank, Lindsay for, helping us work through this and taking some of the feedback that we got from the last subcommittee um, to try to, satisfy those some of the concerns. And I mean, we think this is a good compromise. And again, I want to, thank Lindsay for that.
One problem that I
With the
see
amendment.
emerging from this is that this moves it out of the public safety code and moves it into the criminal law article. If that had been the case originally, we would not have received this bill. It would have been assigned to judiciary. So I don't think we can move this bill out of subcommittee before the full committee until we give judiciary a chance. There have been other bills in the past that have criminalized certain behaviors, such as an assault on a nurse in an emergency room, that we've been reluctant to move forward because of the criminalization of behavior. And so we will have to check with judiciary, but I see Delegate Harris has joined us. Let me give the floor to him.
Yeah, I appreciate that, Mr. Chair, and I appreciate the info that you already provided to me and provided to the rest of the committee. I stand ready to support anything that you all believe is right for this particular piece of legislation. I know we wanted to transition it to a different code, and so we'll see how that goes with your conversation with judiciary.
Okay, thank you. And Chief, part of this is an attempt to address the concerns that you brought up at the bill hearing and at the last subcommittee meeting, that these wouldn't be in the 911 code, and it would be a different designation of a Department of Transportation first responder rather than a first responder under the same code as the EMTs and fire and rescue.
I thank you very much for that. I think, and the good delegate, Mr. Harris, and I had a conversation on this, and his people need to be represented and they need to be recognized for what they did. Our feeling was not anything having to do against what he was trying to do. I just didn't feel like it belonged to public safety. That was all.
Yeah, so this is how we're trying to fix it, but we've run into another issue. So we'll keep you informed, Chief, about what happens with this bill. And I thank you for joining us today.
Well,
unfortunately, I think we're going to have to hold this until we hear back from judiciary, but I'll go ahead and call on Delegate Shalega first.
thank you, sir.
Thank you, Mr. Chair. In the rule book that we talked about earlier today, it says that an amendment cannot have the effect of changing the original purpose of the bill or resolution. So I think under the rules, we can't change this, and it would be, all due respect to the sponsor, Delegate Harris, not personal at all, but, this deserves a full hearing in judiciary. And, for that reason, I think that under the rule, you can't just strike a bill and put something else in there.
Yeah, that very well may be where we proceed with this, Delegate Shalega, and I'm sure Delegate Harris knows how diligently we have been working trying to find a solution for him, as well as Ms. Smalls. But unfortunately, we're not going to be able to move ahead with this bill today. So I'm going to go ahead and hold it and move on to House Bill 905. Thank you, Delegate Harris.
You back to 905? That's the clinical staffing.
Nope. Oh, I see what happened. 662. Delegate Tomlinson.
As introduced, this bill expanded the authority to engage in master contracting to all executive branch procurement units by repealing authority for only designated procurement units to adopt master contracting. The amendments from the sponsor strike the bill. with the exception of some technical corrections, and instead authorize a procurement officer to award an indefinite quantity contract under certain circumstances, specifies requirements for indefinite quantity contracts, and requires the Board of Public Works to adopt regulations establishing methods of assigning work under an indefinite quantity contract.
Did Delegate Tomlinson join us? I don't see him.
Anyone
Lindsay,
from DGS is here. I believe he worked with DGS on this.
okay, thank you. Do I hear a motion on the amendment?
Move the amendment.
Second.
And a second. Okay, any discussion on the amendment? All in favor? Oh, Delegate Shalega, go ahead.
Can you explain it again? I have the bill in
Please.
front of me and I'm sorry, Lindsay, you talked too fast.
Sorry about that.
My brain, it wasn't you. My brain just wasn't tracking yet as I was looking for the bill.
So there were some technical corrections in the original bill. Those are retained. And then the bill otherwise authorizes a procurement officer to award an indefinite quantity contract under certain circumstances, specifies requirements for an indefinite quantity contract, and requires the Board of Public Works to adopt regulations establishing methods for assigning work under an indefinite quantity contract. So indefinite quantity contracts are covered now under COMAR with regard to A&E contracts. So this bill is modeled on those provisions. And I think I see Delegate Tomlinson joined.
Okay. Oh, there he is. Delegate Tomlinson, we were just discussing your bill. Let me give you an opportunity to speak to it.
Yeah, I think council explained it as good as I can explain it. We worked together to craft the bill along with DGS, their deputy chief procurement officer, and it's essentially taking what is already an existing method for divvying up the work when you make multiple awards. Currently the way it's explained in COMAR, it only applies to architecture and engineering contracts. In the statute, it's kind of unclear. So this is making it clear that you can use this method. And when I say method, I want to make sure I'm clear. That's not a procurement method. It's a method in which you divvy up the work when you make multiple awards. It's just saying that you can use that regardless of whether it's an architecture and engineering. You can use it for an RFP or whatever, however you want to, whatever procurement method you use on the front end.
Okay, thank you. Let me call on, well, first of all, let me move the amendments.
Move the amendment.
Okay,
Second,
all right. Amendments have been moved and seconded. Delegate Hill.
Just confirming, I think Delegate Thomas, everyone's on board. There's no opposition. All the stakeholders are fine with this. This is consensus. Okay. Thank you.
Correct.
Any further discussion? We'll vote on the amendments then. All in favor of adopting the amendments, say aye.
Aye.
Any opposition to adopting the amendments? Seeing none, the amendments are adopted.
Move the bill as amended.
second,
Okay, we have a motion and a second on the amended bill. Any discussion? Seeing none, I'll call for a vote. All in favor of the bill as amended, say aye.
Aye.
aye,
Aye.
Okay, any opposition to the amended bill? Seeing none, the bill moves ahead to the full committee unanimously. Thanks for all your work on this, Delegate Tomlinson.
Thank you for all your work. Thank you, Delegate Kerr, and the rest of the subcommittee. Appreciate it. Thank you.
That was 662. Let's move to 448. That's Lindsay's bill. And Delegate Kipke.
This bill generally establishes uniform definitions related to the military and the election law, general provisions, public utilities, and state government articles, primarily by reference to definitions in the U.S. Code. While numerous changes in the bill are only stylistic or technical, there are some substantive changes. Notably, the bill expands eligibility for burial in a state veteran cemetery and the use of mail to file for candidacy in an election, and expands access to certain housing and employment privileges and protections. I circulated 2 amendments from the bill sponsor that include provisions from the Burial Equity Act, allowing members of the National Guard and reserves to be buried in state veteran cemeteries, and also restores honorable discharge qualifications in several articles of code, reserves benefits to the Public Health Service and NOAA, and makes further clarifications and reversions to existing law. In relation to this amendment and amendments for the next bill, House Bill 466, I raised to the sponsor that this committee has already acted on the Burial Equity Act to adopt a definition of veteran and reserve component that is different than is in these amendments. So I wanted to raise, sort of flag that issue for you all for your discussion today.
Delegate Kipke, I know we talked about this briefly this morning. And do we have a resolution for that?
So the amendments that I'm offering are the amendments that were adopted and passed in the Senate. This was all run past the, whatever we call the Maryland Veterans Administration now, Veterans and Family, I can't remember what we call it. They have blessed this, and we also had the governor's legislative folks look at this as well, and they have blessed this as well. I think the sponsor of the bill in the Senate, who did all the work on this, his goal is to align definitions with the federal definitions. So the subcommittee could change that or not. I don't have strong feelings either way, but happy to engage in any conversation about it. Thank you.
So, Lindsay, where does that put us in compliance with House Bill 138?
So if you adopt to do something different than in House Bill 138, which is the Burial Equity Act that's already moved out of the House, the Senate would just amend that to match these bills, and it would return and you would concur.
Okay, it sounds straightforward enough.
The main point is just to make sure everything ends up in the same place.
Yeah, okay. And we can do that with crossover and concurrences. I forget, did I move the amendment? I don't think I did yet.
Move the amendments.
Second on the amendment?
Second.
Okay, the amendments have been moved and seconded. Any further discussion on the amendments? All in favor of adopting the amendment, say aye.
Aye.
Okay, any opposition to adopting the amendments?
Move the bill.
Second.
Okay, we have a motion and a second on the amended bill. Questions or discussion? All in favor of the bill as amended, say aye.
Aye.
Opposition to the amended bill? Okay, the bill moves forward. 466. Again, Delegate Kipke and Lindsay.
This bill generally establishes uniform definitions related to the military in the general provisions, health occupations, housing and community development, and state government articles. Again, primarily in reference to definitions in the U.S. Code. While numerous alterations within the bill are only stylistic or technical changes, there are substantive changes, making certain provisions applicable to all members of the uniformed services, thereby expanding eligibility for certain privileges and benefits. For example, expedited health occupational licensing, fee exemptions for vital records, and continued eligibility for certain waiver programs. The sponsors offered amendments that make additional changes to align the definitions and terminology in the bill with provisions in the Nurse Practice Act, retains the definition of veteran under the general provisions article as it applies to the application of any state program of benefits, rights, or privileges, thereby retaining the provisions for the Public Health Service and NOAA. Makes clarifying changes to the definition of healthcare facility as it relates to health planning and development, and removes from the bill changes to a provision governing renewable license issued by the Board of Morticians and Funeral Directors, which results in no change to that provision in the bill.
Thank you. Delegate Kipke?
Similar to the last bill, these amendments conform our bill to what the Senate did and has already passed. And they were run by all of the interested parties and their consensus amendments. Thank you.
Okay, let
Move
me
the
move those
amendments.
amendments then.
Move the
Um,
amendments.
Second.
Okay, motion and a second on the amendments. Any further discussion on the amendments? All in favor of adopting the amendments, say aye.
Aye.
Opposition to the amendments. Seeing none, the amendments are adopted on the amended bill.
Move the bill.
Bill is amended.
Okay, we have a motion and a second on the bill as amended. All in favor of it, the bill as amended, say aye.
Aye.
Okay, opposition to the amended bill. Seeing none, we will move that bill.
Okay, Mr. Chair, I have to go to a bill hearing.
Okay, thank you for joining us, Delegate Hill. We are now working on House Bill 699.
As introduced, this bill, with respect to any state program of benefits, rights, or privileges applicable to a veteran under Maryland law, alters the definition of honorable discharge to include a discharge that is less than honorable based on an incident or incidents relating to a diagnosis of post-traumatic stress disorder or traumatic brain injury made by an individual licensed to provide healthcare services at the U.S. Department of Veterans Affairs facility, or an experience of sexual trauma as described under specified federal law disclosed to an individual licensed to provide healthcare services at a U.S. Veterans Affairs facility. The sponsor has circulated amendments that instead that strike that language and instead allow that honorable discharge includes a discharge that is less than honorable if the Department of Veterans and Military Families determines that a discharge should be upgraded based on criteria established under federal law.
And I don't think Delegate Allen is with us. And you said there, tell me again where we are with amendments.
These are amendments from the bill sponsor, so they strike
Okay.
the specific, the diagnosis of post-traumatic stress disorder or an experience of sexual trauma, and instead that it includes a discharge if the Department of Veterans and Military Families determines that a discharge should be upgraded based on criteria established under federal law.
Okay, I got it. Let me move the amendments. Is there a motion on the amendments?
Move the amendment.
Second.
Okay, motion and a second. Discussion on the amendments, Delegate Johnson.
Thank you, Mr. Chair. Now, this is the bill that we were not going to tie to the federal regulations in case those change. Is that correct?
So that was discussion that was had previously under the Burial Equity Act, and the chair raised the question at the bill hearing as far as whether or not it made sense to tie it to federal law. This is the amendment that we've received from the bill sponsor.
Okay, all right, thank you.
All in favor of adopting the amendment, say aye.
Aye.
Okay, opposition to the amendment. Seeing none. On the bill as amended.
Move the bill.
Second.
Okay, we have a motion and a second on the amended bill. All in favor, say aye. Any opposition to the bill? Okay, we will move that one ahead to the full committee. 699. Oh, we're gonna take both of these together here, 765 and 1324, or not together, but in close order. And I think both of those are Aaron's.
Yes.
Okay.
So both of these bills have to deal with the sale of patient debt. The House Bill 765 is an emergency bill that authorizes a hospital to sell debt owed by a patient for hospital services to a governmental unit or entity that is under contract with the unit for the sole purpose of canceling the debt. The contract between the hospital and the governmental unit or contractor purchasing the debt must state that the sole purpose of the sale of the debt is to cancel the debt. The patient is not responsible to the hospital, the governmental unit, or the contractor for any amount of the debt that is sold or any interest, fees, or costs associated with the sale, the debt, or the sale. The HSCRC must treat the amount of payments to hospitals for debt as an offset to uncompensated care amounts reported by hospitals. Medical debt sold under the requirements of the bill does not apply to the requirement that HSCRC assure that rates are set equitably among all purchasers or classes of purchasers of healthcare facility services without undue discrimination or preference. And this bill would terminate December 31st, 2027. If you don't mind, Mr. Chair, I'll just describe 1327 as well.
Yes, please go ahead.
I'm sorry, 1324.
Mhm.
1324 is very similar to House Bill 765, except 1324 would authorize a hospital to sell debt owed by a patient for hospital services to a nonprofit organization that is exempt from taxation under 501c3 of the Internal Revenue Code for the sole purpose of canceling the debt. It is otherwise very much identical to House Bill 765. The amendments that have been offered by Delegate Spiegel, I did a run through, and all of the amendments are language that is currently in House Bill 765. Mr. Chairman, happy to go over those amendments if you'd like me to, or.
But are we looking to combine these two bills?
That would be the decision of the committee. I think it's very doable.
Okay, let me hear from Delegate Ivy. Oh, first.
Well, first of all, thank you so much for the work that you all are doing in this committee. Doesn't go unnoticed here. The legislation that I proposed is in line with Senate Bill 1006, Senator Hayes' bill from last session, which almost passed both chambers. It did, but it got held up on sine die. I, would defer to the will of the committee, the subcommittee, on how to move forward with these two pieces of legislation. I'm not proposing a whole bunch of bills this year, so I will say that, but would defer and would be happy with whatever y'all decide to do here, as long as we can move policy forward.
Okay, thank you, Delegate Ivy. And stick around in case we need you to answer some questions.
Please.
Aaron, do you want to go back to you had said about talking about the amendments? Got to unmute, sorry.
Delegate Spiegel had provided, has the amendment office doing them now, but I did provide a copy of what the amendment office is working on. And like I said, all of the amendments that have been offered are currently in House Bill 765. So there's an amendment that requires nonprofit organization. Well, in 765, it would be for the governmental entity, but for 1324, it would require the nonprofit organizations to seek reversal of judgments or adverse information previously reported to consumer reporting agencies related to sold debt. It adds language that for hospital debts owed by patients of the hospital that the hospital sold to the nonprofit organization, they would have to include information on the total dollar amount of the debt that was sold, the total dollar amount paid to the hospital by the nonprofit organization, and the total number of patients whose debt was sold to the nonprofit organization. There is other language that provides that debt sold under the subsection must be for hospital services provided at least 2 years before the date of the sale. And then also that a sunset is also placed on 1324 that would sunset the bill December 31st, 2027.
Thank you. Well, this is kind of out of the ordinary with talking about two bills at the same time, so I won't move any amendments or anything before I open up for discussion. Delegate Johnson.
Thank you, Mr. Chair. Thank you, Delegate. Delegate, one is government and one is nonprofit. Would there be any problem if we combine these bills? Would there be any problem in the Senate, do you think? Because my suggestion is going to be if there would be a problem, we just move them independently and move forward.
I don't see there being an issue with these pieces of legislation being combined into one. And I did misspeak. The last bill, 1006 from last year, the Senate bill, was going to use ARPA funding, and that provision is not in this legislation, in either pieces of legislation here. So I just want to be clear about that. But I don't believe that these bills would be seen as problematic in the Senate, specifically with the differences or what they're looking to achieve here.
All right, thank you. Thank you.
Yep. Delegate Chisholm.
I was gonna say the same thing, just combine the two since it doesn't seem to be in conflict, and then just add Delegate Spiegel to as a co-sponsor if he's amendable to that.
Thank you. Delegate Shalega.
Thank you. And Delegate Ivy, I think you hit on, I had voted against that bill last year because it was tied to ARPA money, but you're telling me now, what nonprofit is buying medical debt? Is it some rich, nice person that just wants to buy debt and pay it off, or who's doing that? How do I meet them?
Right. Well, I haven't done my research on the nonprofit aspect of it, but there are many individuals in this country who see fit to do things like this.
Yeah, how nice. What government, it's one, and this may not be your bill, it may be the other bill. So when we're saying now government can pay off medical debt, what government's paying off medical debt? Do you know?
So it's enabling legislation. It's not requiring any of the governments, local municipalities to do this. But if they see an opportunity to set aside funding for this initiative, that they would be allowed to do so. I said in the hearing, maybe it was a week ago, maybe 2 weeks ago now, I don't see it being implemented this year because we don't know if the sky will fall on us or not this year, just to be candid with you. But to allow for this process to begin, to allow for the governments to even like work on it as a possibility, to put it in their mind and begin planning on it.
Okay, but it is not, to be specific, ARPA money that was considered last year. Thank you.
Right, thank you, Delegate Shalega. It sounds like the will of the subcommittee is that we find a way to craft these two bills together. And that will take longer than we have today. Aaron, can you combine these two bills and bring them back at our next subcommittee meeting?
Yes, definitely.
Okay, and that it should move pretty quickly then, Delegate Ivy. And just a heads up, we will be meeting Monday at 9 a.m.
Wonderful.
for subcommittee. So this one should be pretty quick. We'll take this up, and also House Bill 500 is going to be the focus of Monday's meeting. All right, then we will put a little hold on those two bills as we work them into a single bill and take them up again next week. We'll move on to House Bill 304.
As introduced, this bill makes changes to state procurement-related definitions, processes, and requirements affecting change orders and contract modifications, bid protests and contract claims, debriefings for unsuccessful offers, and procurement ethics. The amendments circulated from the sponsor remove from the bill changes to the definition of change order and contract modification, authorizes unsuccessful offers to request a debriefing rather than requiring a debriefing, requires the debriefing to be as soon as feasible and before the recommended contract award is presented to the head of the unit or BPW for approval, requires the debriefing to include relevant requested information, but excludes information that the procurement officer reasonably determines to be confidential or proprietary, removes the list of specific information required to be included in the debrief and instead requires the Office of State Procurement to establish debriefing guidelines, requires contracts to include clauses for contract modification to provide an equitable adjustment to compensate the contractor, for cost and time increases due to changes in law rather than a change order, clarifies that requirements for review of protests applies to timely protests, authorizes decisions relating to protests to be reviewed by the unit head's designee and the head of the principal department's designee, strikes the requirement to review a protest within a certain period of time, but it authorizes a protester to deem a protest denied after 60 days with no decision issued, establishes that the action of the procurement officer rather than the reviewing authority shall be the final action of the unit, alters the time to file a notice of claim to 60 days. It's 30 days in current law, and the original bill had 90 days, and changes the tolling of that time period to the later of the denied request for equitable adjustment or reaching an impasse rather than the earlier of those two. Establishes requirements for a procurement officer with regard to timely contract claims, mirroring the same requirements for protests. Again, like for protests, authorizes the designees to review the decision of the procurement officer and establishes that the action of the procurement officer is the final action of the unit. strikes language regarding the time period for resolving contract claims, limits recovery under a contract claim to certain expenses, and strikes language from the bill allowing the award of certain costs and specifying appeals from the appeals board decisions.
Thank you, Lindsay. That sounds like a lot. And I know that Scott Livingston and Jamie Tomaszewski has been working fairly tirelessly on this over the last few weeks. And Scott was my key witness on my panel, my sponsor panel. So let me turn it over to you, Mr. Livingston. You're not unmuted yet.
How about now?
You're good.
Okay. All right. So with respect to this bill, it will improve the transparency and allow for a bit more streamlining for the procedures for dealing with disputes. It will help a few things that are worthwhile helping, and it'll get rid of some of the old language that I had a hand in drafting 40 years ago when the then new procurement laws were coming out. I'd recommend that we go forward with it with one suggestion. The bill as submitted by Jamie Tomaszewski and agreed to by other people called for the bill to be effective July 1st, and instead it says October 1st. So with that change, I recommend that the committee go forward with it.
Jamie, thanks for working on this with Scott. And let me go ahead and give you the floor.
Thank you, Chair. It's been a great pleasure working with everyone on this bill, and we're happy with the results. As Mr. Livingston stated, when we drafted the amendment, we just put as the date of this act. And so when it was resubmitted, it was, I guess, automatically put to October 1st. We have no problems with it being a July 1st start. That's totally up to you on when you want the bill to begin.
All right. Is there any discussion on the bill? There is the matter of a fiscal note. Jamie, have you and Scott had a chance to review that? And do you agree with the accuracy of the note?
I will have to say I have not looked at the fiscal note.
Okay.
I'll be happy to take a look at that. From our standpoint, we didn't see anything that would be additional as far as any change in staffing to deal with the breakout of contract claims versus protests.
All right, so this is existing resources for you?
Yes.
Okay, thank you.
Does existing resources for DGS mean that the fiscal note will go down to zero?
Hopefully it will. I think what we can do is we can move this bill today. And if it turns out to be problematic, we may have to interrupt its progress at some point in the future. But I don't think there's any reason that we shouldn't move it ahead today, considering all of the amending that you did to try and avoid that. So do I have a motion on the bill?
Move the bill.
Second.
Okay, motion in a second. And, oh, I'm sorry. We have amendments to take up. Let me back up.
Move the amendments.
Move the
Second.
amendments. All right, motions have been moved and seconded. All in favor of the amendments?
Aye.
Any opposition to the amendments? Thank you. On the amended bill?
Move the bill as amended.
Second.
All right, we have a motion and a second on the amended bill. All in favor of the amended bill, say aye.
Aye.
Any opposition to the amended bill? Delegate Chisholm?
I'm just going to be recorded in the nay for now as a reminder for us to all check that fiscal note. I know everybody's got a lot of stuff going on, but hopefully it will serve as a reminder to both of us.
Okay, I'll make a note of that. Thank you, Delegate Chisholm. All right, then we'll proceed with this and hope we can get the resolution on the fiscal note. Thank you, Scott. Thank you, Jamie.
Thank you to all the committee members.
Yes, thank you. Great day.
Okay, we're making great progress today. Let's move on to House Bill 1422.
This bill establishes the Maryland Reparations Commission, staffed by the Maryland State Archives, and the public historically Black college or university represented as a member of the commission. The commission must study and make recommendations relating to appropriate benefits to be offered to individuals impacted by historical inequality. By January 1st, 2027, submit a preliminary report of its findings and recommendations, and then by November 1st, 2027, submit a final report of its findings and recommendations to the Governor and General Assembly.
Hey, is Delegate McCaskill with us today? Is there anyone here to speak to this bill? Go ahead and raise your hand. Not seeing anyone. Scott, I think your hand's probably just a holdover from the last bill.
It is. I
Okay.
don't know how to undo my hand.
Okay, I'll just ignore you then. Do I have a motion on this bill?
Move favorable.
Second?
Second.
Okay, I have a motion to second on the bill. I'm sorry. Once again, I've totally ignored the amendments. Let me back up again. Do I have a motion on the amendments?
Move the amendment. Second.
The
Second.
sponsor hasn't offered any amendments on this bill.
Yeah,
I was gonna
see
say, what's
amendments.
the amendments?
Yeah, I don't.
Oh, I see. Yep, I see a note here about ADOS, not from the sponsor. All right. Ignore my last comment.
What is the amendment?
There is no amendment.
Move the bill.
Move the bill.
Favorable. Second. Second.
All right, on discussion of the bill, seeing none, a call for a vote. All in favor of House Bill 1422, say aye.
Aye.
Opposition to the bill. Delegate Chisholm, Delegate Kipke, Delegate Shalega. Okay, thank you everyone for all your work on this. It looks like we got through the whole agenda. So we will be sending out an
Delegate
email.
Carr,
Held one bill from
you
earlier.
were going to revisit House Bill 905, which Andrew Nicholas was looking at the amendments from the Hospital Association.
Thanks for reminding me. Thanks. That was
905.
okay. Can we go back to 905, please?
Hold on, this is.
So I had described it, we talked about it a little bit, and
When we had wondered, Andrew,
Yes.
to you, we had given you a chance to look this over.
Yes, so what I can say, so these are fairly extensive amendments. I think I can safely respond to your question, Delegate Chisholm, that no, what is described in the bill, even as amended, does not reflect current hospital operations, so that would be different. However, anything kind of beyond that, given the extent of these amendments, I would have to take back to the members for additional feedback on.
All right. Andrew, I'll give you some time to do that. And we can take this up with the others on Monday.
Appreciate that.
Okay. Did I forget anything else, Aaron?
You're good.
All right.
Lindsay too.
Okay. In that
Motion
case,
to adjourn.
all right. In that case, we have a motion to adjourn.
And we're voting at 2?
We're voting at 2 in HGO and then bill hearings following. Thanks, everyone.
Thank you.
And we're adjourned.